Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's press conference, where we'll be providing an update on COVID-19 epidemiology and modeling in Canada. Bienvenue à la conférence de presse aujourd'hui pour fournir une mise à jour sur les modèles épidémiologiques de la COVID-19 au Canada. Today, we'll hear remarks from Canada's Chief Public Health Officer, Dr. Theresa Tam, and Howard New. The doctors will be available for questions afterward. Aujourd'hui, nous entendrons des allocutions de la Dr. Tam, administratrice en chef de la santé publique, et du Dr. Howard New, sous-administrateur en chef de la santé publique du Canada. Les docteurs sont disponibles pour répondre aux questions après leurs allocutions. If you wish to ask a question, please press *1 on your phone. Si vous désirez poser une question, appuyez sur étoile 1. Procédons à la séance. Let's begin. Over to you, Dr. Tam.
Merci, Eric. Bonjour à toutes et à tous.
Thank you, Eric. Good
Today,
day, everyone.
we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Despite the very real challenges being faced at the height of the current wave, the efforts we've made give us reason for optimism. But we must remain mindful of the need for continued caution in the months ahead. Nationally, vaccination rates have continued to increase, and we now have above 80% of the eligible population with at least one dose of COVID-19 vaccines in every province and territory, which bodes well for further increasing protection for Canadians nationwide. And public health measures have continued to prove effective in slowing the spread where the virus is surging, despite the presence of the game-changing Delta variant. Nevertheless, over the past month, lessons have been hard learned where measures were relaxed too much or too soon, and especially where vaccination coverage remains low, providing further cautionary tales on the relentless behavior and severe impacts of this virus. As we head into Thanksgiving weekend, faced with very different epidemiological situations, depending on where we are or will be in the country, this update is a reminder that although we've made important gains, we'll need to maintain basic but essential precautions to see us safely through the respiratory infections season ahead. So Canadians, whether fully vaccinated or not, are urged to continue heeding local public health advice and be vigilant with well-practiced precautions that keep us safer indoors, including masking, avoiding crowding, and improving ventilation. On slide 1. Since the previous modeling update, the average daily case counts have increased, but at a slower pace than had been forecasted last month. Public health measures reapplied in late August and September to slow the acceleration of the Delta variant transmission have helped to bend the curve, with daily cases leveling off in recent weeks at the national level. Over the past week, there were an average of over 3,700 new cases being reported daily across Canada, compared to the over 8,500 daily cases forecasted by mid-September based on our previous trajectory. Unfortunately, severe illness outcomes occurring primarily among unvaccinated people are still elevated. On average, over the past week, 2,500 people with COVID-19 were being treated in our hospitals each day, including 770 in intensive care units, and 38 deaths were reported daily.
Bonjour à toutes et à tous.
Good day, everyone.
Aujourd'hui, nous ferons le point sur les travaux
Today, we'll provide the
épidémiologiques
latest
et de
update on
modélisation
national
effectués au pays qui
epidemiology and
orientent la
modeling
gestion
work that
continue de la
informs the ongoing
COVID-19 au
management
Canada.
of COVID-19 in
Malgré les
Canada.
défis bien réels que nous avons à
Despite the
relever
very
alors que
real
la vague actuelle atteint
challenges
son
being
sommet,
faced
les
at the height
efforts
of the current
déployés nous
wave,
permettent
the efforts
d'être
we've made
optimistes,
give us
bien que nous
reason
devons avoir
for
conscience de la
optimism, but we
nécessité
must
de
remain
demeurer
mindful of the
prudent
need for
au cours des
continued
prochains
caution
mois.
in the months
À l'échelle
ahead.
nationale, les taux de
Nationally,
vaccination continuent d'augmenter
vaccination
et
rates
plus
have
de
continued to
80%
increase,
des personnes
and we
admissibles
now have
ont désormais
above
reçu au
80%
moins
of the
une dose
eligible
de vaccin
population
contre la
with at
COVID-19
least one
dans chaque
dose
province
of
et
COVID-19
territoire,
vaccines
ce
in
qui
every province and
est
territory,
prometteur en ce qui
which
concerne une
bodes
protection
well for
encore
further
plus grande
increasing
de la
protection
population
for
canadienne
Canadians
dans l'ensemble du pays.
nationwide.
De plus, les mesures sanitaires
And
continuent de
public health
ralentir
measures
efficacement
have
la
continued to
propagation
prove effective
là où le
in
virus
slowing the
est en
spread where the
recrudescence,
virus is
en
surging,
dépit de la présence d'un
despite
variant
the
qui a
presence
changé
of
la
the
donne, le
game-changing
variant Delta.
Delta variant.
Cependant, Au cours des derniers mois, on
Nevertheless,
a
over
tiré
the
de
past
dures
month,
leçons contre
lessons
mesures qui
have
ont
been
été
hard
trop
learned
assouplies
where
ou
measures were
assouplies trop
relaxed
tôt,
too
en
much
particulier
or
là
too
où la
soon,
couverture
and
vaccinale
especially
demeure
where
faible.
vaccination
Leçons
coverage
qui nous invitent
remains
à
low,
continuer de faire preuve de
providing further
précaution devant
cautionary
le virus
tales on
implacable
the relentless
qui a des
behavior
graves
and
effets.
severe impacts
À la veille
of
de la
this
fin des
virus.
semaines de l'Action de grâce, alors que la
As we
situation
head into
épidémiologique
Thanksgiving
varie
weekend,
selon l'endroit
faced
où
with
l'on
very
se
different
trouve ou
epidemiological
où l'on
situations
se
depending
trouvera
on
au pays,
where we are
la
or
présente
where we
mise
will
à jour
be in the
vise à
country,
rappeler que nous
this
devrons,
update is a reminder
malgré des
that
gains
although we've made
importants,
important
continuer
gains,
d'appliquer les
we need to
précautions de
maintain
base
basic but
essentielles à notre
essential
protection
precautions
au cours de la
to see
saison
us
des
safely
infections
through the
respiratoires
respiratory
qui est à
infection
nos portes.
season ahead.
Ainsi, nous conseillons vivement aux
So,
Canadiens et aux
Canadians,
Canadiens,
whether
qu'ils
fully
soient
vaccinated
entièrement
or not,
vaccinés ou
are
non,
urged to
de
continue
continuer
heeding
à tenir compte
local
des
public
conseils
health
de leur
advice
autorité
and to be
sanitaire
vigilant
locale
with
et à appliquer les
well-practiced
précautions
precautions
et
that
sûreté
keep
à
us
l'intérieur,
safer
notamment le
indoors,
port de masque, la
including
limitation des
masking,
rassemblements et
avoiding crowding,
l'amélioration de la
and
ventilation.
improving ventilation.
Dr. Tam a déjà parlé de
Dr.
diapositive
Tam
1,
already spoke
alors
about slide
diapositive
1.
2.
So now for
La
slide
situation
2.
vécue dans les 6 provinces les plus
The
populeuses
6 most
illustre les
populous
variations
provinces
considérables
illustrate
quant à
some of the
l'activité de la
considerable
maladie au
variation
cours de
in
la
disease
quatrième
activity
vague au
experienced
Canada.
during Canada's
Des
fourth
provinces
wave.
durement touchées dans le passé, mais qui ont
Previously
maintenu
hard-hit
les
provinces
restrictions
that
et œuvré
maintained
à une couverture
restrictions
vaccinale
while
élevée
striving for
ont
high
connu une
vaccination
quatrième vague
coverage
assez modeste
experienced
par
a
rapport aux
relatively
vagues
smaller
précédentes.
fourth wave
D'autres
compared to
régions
previous
qui ont
waves.
assoupli de trop nombreuses mesures
Other
ou
areas that
ont
relaxed
procédé
too
à
many
un
measures
assouplissement
too
trop
quickly
rapide, c'est-à-dire avant l'atteinte
before
d'une couverture
high enough
vaccinale
vaccination
suffisante,
coverage
ont connu
was
une
achieved,
recrudescence vaste et
experienced
marquée de
a sharp
l'activité de la
and
maladie,
large
suivie d'une
rebound in disease
augmentation
activity,
tout aussi marquée des cas
followed by a
graves, qui
similarly
continue
sharp
de peser
increase
lourd sur le
in
système de
severe
santé,
illnesses
en
that continues
particulier
to
sur la
place
capacité des
a
soins
heavy
intensifs.
strain on the health
Ne sont
system
pas illustrées ici les
and
régions du pays
particularly
où la
critical care
propagation a
capacity.
été adéquatement
Not
contenue
illustrated here are other areas of the
durant à peu
country
près
where
toute la
spread has
population,
been well
période
contained during
pandémique, mais
most
où
of the pandemic,
l'introduction de cas
but where
restreint à un
localized
secteur où
introductions
la couverture
into
vaccinale
areas with lower
était faible,
vaccination
a
coverage
entraîné une
have resulted
propagation rapide au sein
in
de la
rapid
collectivité.
community spread.
Slide 3. In recent days, following weeks of tightening public health measures in heavily impacted areas of Canada, the national RT, or reproduction number, has dropped below 1. This means that for the first time since mid-July, the epidemic has dropped out of a growth pattern nationally. However, RT has only just fallen below 1 nationally, and it may still be at or above 1 in some areas. To bring the epidemic under control, RT needs to be maintained consistently below 1.
Diapositive 4. Depuis le début de la
Slide 4.
vaccination à la mi-décembre, plus de
More
56,8
than
millions de doses de vaccins contre
56.8
la
million
COVID-19
doses of
ont été
COVID-19
administrés
vaccines
au
have been
Canada,
administered
avec plus
across
de
Canada since vaccination began in
88% de la
mid-December,
population admissible
providing over
âgée de 12 ans et
88% of
plus
the eligible
ayant reçu
population
au moins une
aged
dose de
12
vaccin
years or
contre la
older with at least
COVID-19
one dose
et
of
plus de
COVID-19 vaccine,
82% des
and
Canadiens
over
admissibles
82% of
étant
eligible
entièrement
Canadians
vaccinés.
are fully
Franchir la
vaccinated.
dernière étape pour obtenir une couverture vaccinale très élevée
Covering this
dans tous les
last
groupes d'âge
stretch
admissibles et dans
to
toutes les
achieve high
régions
vaccination
s'avère
coverage
crucial
across
pour
all
réduire la
eligible
gravité
age
et
groups
les
in all
répercussions de la
areas
vague
is crucial
provoquée
to
par le
reducing the
variant
impact
Delta
and
dans les
severity of
collectivités
the
de
Delta-driven
partout au
wave
pays.
in communities
Pour
across the
augmenter
country,
rapidement le recours à la vaccination, y compris pour les
further
premières doses, la
increasing
santé publique
vaccine
et les
uptake,
communautés devront
including for
parfaire
first
leurs
doses,
approches ciblées
will
pour
require
réduire
public
les
health
obstacles,
and communities
fournir
to
un
hone
soutien et
targeted
rejoindre
outreach
les gens
approaches
là où
that
ils sont.
reduce barriers, provide support,
Qu'il
and
s'agisse
reach
d'offrir des
people
cliniques
where they are.
mobiles et davantage de lieux
Everything from
accessibles,
mobile
sans
clinics
rendez-vous,
and
des
drop-in
renseignements ou
access
des
to more
ressources dans
locations,
différentes langues et
information,
adaptées à la
language,
culture,
and cultural
tout peut
outreach
contribuer à ce
resources
qu'une plus
can make a
grande partie
difference
de la
to getting more of
population
the
soit
population informed,
informée, confiante
confident,
et
and
protégée.
protected.
Néanmoins, là où il y a de
Nevertheless,
petits groupes de
where
personnes
there are
insuffisamment
pockets
vaccinées,
of
il y a une risque
undervaccinated
constante
people,
de
there is
propagation
an ongoing
communautaire
risk for
rapide,
rapid
d'un
community
nombre
spread,
élevé de patients
high numbers
hospitalisés
in
ou
hospital and
aux
critical
soins
care,
intensifs, des
strain
pressions
on the health
exercées sur le
system
système de santé et
and
d'une émergence
a
possible de
worrying
nouveaux variants
potential for
préoccupants.
emergence of new variants of concern.
On slide 5, although vaccine coverage has increased across the age groups, with over 84 to 95% fully vaccinated coverage in adults aged 50 years or older, vaccination coverage is lower in the younger age groups, leaving a significant protection gap. Not surprisingly, infection rates continue to be highest in these younger age groups. Although COVID-19 has generally been less severe in younger people, serious or prolonged illness can occur in any age group, and with the more severe Delta variant predominating and very high numbers of people infected, serious illness is being seen more often. Increasing vaccine coverage is not only important to reduce the pool of susceptible people and lessening the impact of the Delta wave, but also to limit the spread to children too young to be vaccinated and into schools and beyond. For parents of children under 12 years, getting yourself vaccinated is an important way to contribute to their protection against COVID-19 and help keep them in school and doing the activities that they love. There are still nearly 6 million eligible Canadians that are not yet fully vaccinated, and this is why we must continue to increase vaccine coverage and protect everyone we can.
Diapositive 6.
Slide 6.
Les régions sanitaires qui ont atteint des
Health
taux de
regions
vaccination
that have
élevés
achieved
et
high
qui, pour la
vaccination
plupart,
rates,
ont maintenu un ensemble
most
de
of
mesures
which
visant
maintained
à
a
ralentir
range
la
of measures
propagation
to slow
pendant que se
transmission rates
développait
while
la couverture
coverage was
vaccinale,
building,
ont pu maintenir des
have
taux
been able to
d'infection
keep
faibles.
infection rates
Ces
lower.
régions sont maintenant
These
dans une
regions
meilleure
are now
position
in
à
a
l'approche de
stronger
l'hiver
position
et de la
of
saison des
having
virus
high vaccine
respiratoires,
coverage
car
and
elles
low disease
bénéficient d'une
incidence
couverture vaccinale
seen
élevée et d'une faible
as
incidence de la
the
maladie.
green
Elles sont représentées par les
and
zones
blue
vertes
areas
et bleues sur la
on the
carte.
map.
En revanche, les régions où la
On the
couverture
other
vaccinale
hand,
est faible, en
areas with
particulier
lower
celles qui ont
vaccination
assoupi les
coverage,
mesures trop tôt ou trop
particularly those
rapidement,
that eased
connaissent
measures
une
too soon or
incidence
too
très
quickly,
élevée de la
are
maladie,
experiencing
notamment
very
en
high
ce qui a
incidence,
trait aux personnes
including
gravement
severe
malades et aux
illnesses
pressions
and
qui en
resulting
résultent pour le
strain
système de
on the health
santé.
system.
Ces régions se trouvent dans une situation difficile
These
car leur
regions are in a
couverture
challenging
vaccinale est
position
encore
of
trop
having
faible
still
alors que
too low
l'incidence reste
vaccination
élevée,
coverage
comme le
with
montrent
ongoing
les
high
zones de couleur
incidence
rouge et violet
seen
sur
as
la
red
carte.
and purple
À
colored
l'aube de la
areas on the
saison des
map.
maladies respiratoires, dans un
Heading
contexte où
into
les
the
capacités de
respiratory
soins de santé
season
sont
with
déjà mises à
healthcare
rude
capacity
épreuve,
already under
il
heavy
est
strain
d'autant plus urgent
increases the
d'adopter une
urgency for
approche
a
combinée
combined
consistant
approach
à maintenir
of
des
maintaining
restrictions de
public
santé
health
publique pour
restrictions
ralentir la
to slow
propagation
the
de la
spread
maladie et à
and
augmenter
rapidly
rapidement le
increase
taux de
vaccine
vaccination pour
uptake
protéger un plus
to
grand nombre
protect
de
more
personnes
people
contre les formes
from
graves de
severe
la maladie.
illness.
Toutefois, même dans les régions où la couverture
However,
vaccinale est modérée ou
even
élevée,
areas with
il
moderate to
convient de
high
maintenir
vaccination
les
coverage
précautions de base,
need to
comme le port de
maintain
masque et
basic
les limites
precautions,
relatives
such
à
as
la taille de
masking and
rassemblement
limiting
et de
gathering
s'assurer de
sizes
pouvoir
while ensuring
intervenir
a quick
rapidement en
response
cas
to
d'augmentation
any
subite
rapid
des cas,
increase
car nous
in
passerons
cases
plus de temps
as
à
we spend
l'intérieur
more time
au cours des
indoors
prochains mois.
over the coming months.
Slide 7. When you are vaccinated, you reduce your risk of serious illness, hospitalization, and death due to COVID-19. Remember, vaccine takes time to work. It typically takes about 2 weeks following the second dose for the immune system to build up protection. The latest data continue to demonstrate that fully vaccinated people are much less likely to become infected and are highly protected against severe illness due to COVID-19. From mid-August to mid-September, the average weekly rate of COVID-19 cases was 10 times higher in unvaccinated people than in fully vaccinated people, while the average weekly rate of hospitalized cases was 36 times higher in unvaccinated people compared to fully vaccinated people. This aligns well with ongoing vaccine effectiveness studies that demonstrate strong protection against severe illness among fully vaccinated people. As well, based on the continuous close monitoring of COVID-19 vaccines in use across Canada and worldwide, we know the vaccines are very safe and that vaccination remains our best protection.
Diapositive 8. La mise
Slide
à jour des
8.
prévisions à long terme montre comment la
This
trajectoire de
updated
l'épidémie
longer
pourrait
range
évoluer
forecast
au début de
shows how the
novembre.
epidemic
Bien que
trajectory may
l'incertitude demeure,
evolve through
la mise
early
à jour
November.
donne une perspective
While
optimiste
uncertainty
mais
remains,
prudente pour
it
les
provides
prochaines
a
semaines.
cautiously
Si nous
optimistic outlook
poursuivons
for the
notre
coming weeks.
trajectoire en
If we
maintenant la
continue along
vaccination
the
et en
path we are on
soutenant
now,
les mesures de
by
santé publique
maintaining
en
vaccine
vigueur,
uptake
notamment les
and
mesures appliquées
sustaining
de nouveau
existing
là
public
où le
health
virus se
measures,
propage, ce modèle
including those
actualisé
reapplied where the
montre
virus
que
is
nous pourrions
surging,
observer une
this
décroissance de
updated
la
model
vague
shows
provoquée
we
par le
could
variant
expect to
Delta,
see a
selon la
decline of the
trajectoire de la
Delta-driven
ligne
wave
grise
along
foncée.
the dark gray
Il s'agit
line
là d'une
trajectory.
amélioration importante apportée
This
à la
represents a
trajectoire de notre
significant
modèle
improvement
antérieur
over the
du début de
trajectory shown
septembre,
in our
alors que
previous
nous nous
modeling in
attendons
early
à
September,
observer
when
l'épidémie
cases were
reprendre
forecast
rapidement de la
to
vigueur.
resurge rapidly.
Heureusement, le rétablissement des mesures de santé publique dans de
Fortunately,
nombreuses régions du
reintroduction
pays
of
a
public health
contribué
measures
au
in many areas
ralentissement
of
de
the
la
country
transmission
has
dans les
helped
régions
to slow
durement touchées,
transmission in some
comme en
heavily impacted
témoigne
areas, as reflected
l'aplanissement
in
de
a
la
flattening
trajectoire
of the
nationale.
national
Néanmoins,
trajectory.
de nombreuses régions des provinces de l'Ouest ont vu la
Nevertheless, many
multiplication
areas
du
of the
nombre de
country
cas
have
avec comme
experienced
conséquence la
rapidly
hausse des
rising
cas,
cases
des taux
with a
d'infection
consequent
graves.
increase
Par
in
conséquent,
severe
il est
outcome
important de
trends.
souligner que
Hence,
si
it
les
is
mesures de
important
santé
to
publique
underscore
actuelles étaient
that
assouplies
if
de
current
manière
public
à
health measures
accroître
were
les taux de
relaxed
transmission
such that
d'au
transmission
moins
rates increase
15%
up to
comparativement
15%
aux taux
higher than
actuels,
present
les
levels,
prévisions
the
indiquent que nous
forecast
pourrions
predicts
observer une
we could see
recrudescence
a
du nombre de cas
resurgence of
suivant
cases
la
along the
trajectoire
blue
de la
line
ligne bleue.
trajectory.
Ces prévisions témoignent de l'importance et de
This
l'impact des
forecast
principales mesures de
reaffirms the
santé publique
importance and
et de
impact of core
protection
public health
individuelle,
and
comme
personal
porter un
protective
masque et
measures
l'éloignement
like
physique,
mask
et
wearing
ce, même
and
au
physical
niveau actuel de
distancing, even
vaccination.
at current levels of vaccination.
Slide 9. With the level of vaccine coverage that we have achieved in Canada to date, we are much better protected going into the respiratory infection season. And today's modeling update shows that by maintaining basic and less restrictive measures, such as masking and limiting close contacts, we could reduce the impact of COVID-19 this winter. However, the scenario on the left shows that if we let go of these basic public health measures through fall and winter, we could have a serious Delta-driven resurgence with a risk of overwhelming healthcare capacity. Whereas, by keeping these basic protective measures in place, as shown in the scenario on the right, we could reduce the risk of a large wave exceeding healthcare capacity. In this preferred scenario, sustained efforts could minimize severe outcomes and lessen societal disruption by reducing the overall number of cases, hospitalizations, critical illnesses, and deaths due to a very large resurgence. Nevertheless, it is important to stress that even as the fourth wave recedes, COVID-19 is unlikely to disappear entirely, and there could continue to be bumps along the way. Experience in Canada and worldwide throughout the pandemic has shown us that what works best is ongoing vigilance and a combined approach, including achieving high vaccine coverage across the population, making indoor spaces safer with improved ventilation and good adherence to individual layers of protection, such as masking and spacing, and closely monitoring and quickly reapplying public health measures to slow rapid spreads and minimize severe illness where the virus is surging.
Diapositive 10.
Slide
Bien que
10.
plusieurs provinces et territoires soient encore
Although
confrontés à des
several
défis
jurisdictions are
considérables,
still
cette
facing
mise à jour
considerable challenges,
réaffirme qu'en
this update
établissant
reaffirms
une assise
that
solide
by
de protection,
achieving a strong
alors que
foundation
plus
of
de
protection,
82% des
with
Canadiens
over
admissibles sont
82% of
entièrement
eligible
vaccinés
Canadians
et
fully
qu'en appliquant des
vaccinated
mesures de santé
and
publique, il est
applying public
possible
health
de gérer
measures,
la croissance de
epidemic growth
l'épidémie.
can be
À l'échelle
managed.
nationale, le nombre de cas s'est
Nationally,
atténué, mais le
case
nombre
counts have
total des
leveled
cas
off,
demeure très
but
élevé
are still
et les
high
taux d'incidence
overall,
dans certaines
and
régions
infection
sont
rates are
extrêmement
exceedingly
élevés.
high in several areas of the
Avec la
country.
gravité accrue du variant Delta,
With the
de plus
increased
en plus
severity of
de
the Delta
personnes
variant,
deviennent très
this
malades,
wave
ce qui
is
exerce une
making
forte
more
pression sur le
people
système de
very
santé
sick,
où le virus
resulting
est en
in a
plein
heavy
essor.
strain on the health
Alors
system
que le
where
week-end
the
de
virus
l'Action de
is
grâce
surging. As we head into Thanksgiving weekend, Canadians are urged to keep gatherings small and to follow local public health advice based on the local epidemiological situation. We can all make indoor gatherings safer by ensuring that eligible people are fully vaccinated, taking steps to improve indoor ventilation, and using precautions such as masking and physical distancing, especially if some family members cannot be vaccinated. In the case of eligible people who are not yet fully vaccinated or have chosen not to get vaccinated, it is recommended to limit indoor gatherings to household members only or to have outdoor gatherings where possible. The key challenge for this winter will be to consistently continue what we've been doing, protecting our progress and ensuring greater safety in the months ahead means keeping up with basic best practices in all our interactions, which can also help prevent other respiratory infections we may encounter this winter.
Merci, Miigwech.
Slide 10. Although several jurisdictions are still facing considerable challenges, this update reaffirms that by achieving a strong foundation of protection with over 82% of eligible Canadians fully vaccinated and applying public health measures, epidemic growth can be managed. Nationally, case counts have leveled off, but are still high overall, and infection rates are exceedingly high in several areas of the country. With the increased severity of the Delta variant, this wave is making more people very sick, resulting in a heavy strain on the health system where the virus is surging. As we head into Thanksgiving weekend, Canadians are being urged to keep gatherings small and follow local public health advice based on the local epidemiological situation. We can all make indoor gatherings safer by ensuring that eligible people are fully vaccinated, taking steps to improve indoor ventilation, and using precautions such as masking and physical distancing, especially if some family members can't be vaccinated. In the case of eligible people who are not yet fully vaccinated or have chosen not to get vaccinated, it is recommended to limit indoor gatherings to household members only or to have outdoor gatherings where possible. The key challenge for this winter will be to consistently continue what we've been doing. Protecting our progress and ensuring greater safety in the months ahead means keeping up with basic best practices in all of our interactions, which can also help prevent other respiratory infections we may encounter this winter. Thank you. Merci. Miigwech.
Merci, Dr. Tam et Dr. Nu. Thank you. We will now open the telephone line to questions. We ask that you limit yourself to one question and only one follow-up. We'll be taking questions in both official languages. Nous allons maintenant prendre des questions. Nous vous demandons de vous limiter à une question et une question de suivi seulement. Vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la session. Operator, first question.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question est de Louis Blouin de Radio-Canada.
First question from Louis Blouin from Radio-Canada.
Oui, bonjour. Une question pour le Dr. Nu.
I have a question for Dr. Nu and Dr. Tam as well, if you'd like to weigh in.
J'aimerais vous entendre sur la nécessité d'une troisième dose.
I'd like to hear you talk about the need for a third dose or a booster shot. This was published in the New England Journal of Medicine. Do you notice that it is necessary in Canada to have a third dose for the general population? What is your decision on this? Thank you for the question. That is an important question. Here's what I can tell you now. We are continuing to have good discussions with our counterparts in the provinces and territories. Together, we are continuing to analyze the facts in Canada and around the world. Over time, immunity will decrease in the general population. But what we can see here in Canada is that, in general, we still have a good protection, especially when it comes to severe illness in the general population. So a booster shot is a question that we're looking at, and we will continue discussions on it. In certain areas, we see a resurgence and severe illness. If we begin to see that in fully vaccinated populations, that will have an impact on our decision. Also, experts continue to analyze the facts and data, and as they do so, it is possible that we will adapt our approach.
Pour toute la population générale. On parle maintenant
peut-être
pour les populations
for the time being, we are more looking at priority populations getting a booster shot. For example, a population at a heightened risk of complications, but for the general population, we have not taken that call yet. Thank you. Follow-up question? I'd like to hear you talk about the Merck antiviral pill against COVID-19 symptoms. Some other countries are signing deals with Merck, but Canada still has not signed a deal to purchase this medicine. Is there a risk of missing the boat on this? And do you think that this pill can be have as important an impact on fighting the virus? Thank you for another good question. We've looked at scientific and clinical data, and this, or rather, and we have followed what the company has published on this to date. This is an orally ingested medication, and usually I think it's a dose of 4 pills twice a day for 5 days. In the beginning, it can reduce symptoms and decrease the risk of hospitalization.
Avec les autres traitements déjà disponibles dans un hôpital. Maintenant, on est en train d'avoir des discussions avec la compagnie pour
in talks with the company in order to better understand the fact-based data that is currently available. They have held a clinical trial, and it will be important to know what the results of that are. Also, since August, the company has submitted a file to Health Canada, and Health Canada, on its side, is also processing that information, and they're doing so expeditiously, I would add. So we are continuing our discussions with the company. And in regards to what you mentioned, yes, other countries are negotiating contracts with the company, Merck. But in Canada, we too are looking at an advanced purchase agreement. But as of right now, we are in the early stages of our discussions with Merck. As we see it, this really is an effective treatment, and it is another strong tool to have in our toolbox in fighting the virus. So Canada may purchase this medicine. Thank you. Thank you.
The next question is from Mike Couture from Global News. Please go ahead.
Doctors, thank you very much for doing this. I wanted to ask you, you mentioned near the end in slide 10 about Thanksgiving. Some Canadians might, though, be scratching their heads and trying to make sense of different restrictions that we're seeing across the country for social gatherings this weekend. You have Saskatchewan that has the lowest vaccination rate, but no restrictions for private gatherings, whereas provinces with higher vaccination rates seem to have stricter limits. So what are you suggesting people do for this holiday? And I wanted to know from each of you, what will you be doing Thanksgiving this year? Because it is different from last year.
Yes, thank you for the question. And it is a different epidemiologic situation across the country. But you pointed out that different jurisdictions have also chosen to put down different measures. But our advice really is that overall, keep indoor gatherings safer by, asking your guests. It is a difficult question sometimes, but ask your family, or if you had people outside of your family that you're thinking of inviting, do try and ask them whether they've been vaccinated or not, and take that into account. And put down some basic measures such as improving indoor ventilation. Even when it's cooler, you can open your windows a little bit for short periods of time and the doors to help improve indoor ventilation. Use precautions, including spacing or physical distancing if you can, and masking where appropriate if some family members, particularly who have high-risk conditions. But different families will have a different level of common risk tolerance, if you like. So it requires a bit of discussion, but keeping gatherings generally small and respecting these basic measures are recommended, I would say, anywhere in Canada, while following local public health rules. If you're not fully vaccinated, or as we said, then we really should be limiting the gatherings to your household members, and having things outdoors as much as possible. So this will keep the country, as you just seen, the curve is just bending. And if you're in some of the provinces in the middle of the country, you need to be really, really precautionary. I think over this weekend, previously we have seen surges in cases after these holiday events. So this year, with the vaccine on board, I think we should be on a better, more solid footing. But we can't, be too careful when it comes to this formidable foe, as I've said, the Delta variant. In terms of this Thanksgiving, at this point, I have no specific plans to have in-person interactions. I'll be doing most things virtually. And if I do anything, it will be with my immediate family, my parents, for example, who are fully vaccinated. And we have had very thorough discussions with my sort of immediate family members. But all to say is they're all fully vaccinated. And that gives us a little bit more in terms of our options.
Thanks, Doctor. And you may be I'll add to Dr. Tam in terms of personal plans for Thanksgiving. So similar to Dr. Tam, both my wife and I are completely vaccinated, so that's fine. And we're planning to have in-person gatherings with some immediate family members who also, we've discussed with them, they're also completely vaccinated. So I think we're fortunate, even my children, I'm not sure if they actually listen to me or maybe based on other considerations, are fully vaccinated, and they're sort of in that prime age group, millennials, sort of in their sort of early to mid 20s. So I think we're fortunate, but I will state, that I've had conversations with friends who are having a tougher time, with, let's say, especially members of their family who are not vaccinated at all or only partially vaccinated. And I've made it clear that my advice to them, as we've actually stated here, is that, such a gathering should be limited to the immediate household. If let's say it's a family member is not vaccinated, you should politely explain your situation and your discomfort level. And if they choose not to be vaccinated, that's their choice. But there are consequences in terms of even family dynamics and others feeling safe about getting together. So I'll leave it at that. But certainly my personal plans is to have small in-person gatherings all of us fully vaccinated. Thanks.
Thank you, doctors. Follow-up, Mike?
Yeah, first of all, thank you for sharing that personal information. I, as my follow-up, I wanted to know, like, we're getting into that time of the year where snowbirds and other Canadians can start planning their trips down south and elsewhere. So I wanted to know what work is being done by Health Canada with other countries to ensure that fully vaccinated Canadians, including those with a mixed dose regimen, will be allowed into other countries, especially when we consider a great number of Canadians got the AstraZeneca vaccine, and that still isn't approved in countries like the United States.
Yes, thank you for the question. It's something that is uppermost on many Canadians' minds. We have been extremely active in engaging key countries in accepting the schedules that we have been deploying in Canada, which includes mixed dose schedules as well as a stretch interval. The stretch interval probably isn't as much of an issue because there's a minimum interval, but most countries will accept longer intervals. So we've been in contact with countries that are sun destinations, for example, where the majority of them either don't have vaccine requirements at the moment, or they would accept the Canadian vaccination schedules. But you do have to check with individual countries, but there are definitely options. With European countries, we've been having a lot of discussions, mainly with the health departments or the equivalent public health agencies, the European Centre for Disease Control, the European Commission as they're reviewing their policies, and the United Kingdom as well. And the United Kingdom has accepted Canada into one of their pilot streams where they would accept the schedule that we have. Many other European countries already use mixed schedules, so there shouldn't be a problem with probably over a dozen countries in Europe. But I think, again, check before you go. So then comes your more precise question, which is about the United States. So this is one of the most active areas of discussion in terms of the country that we're most interested in. And with the CDC, the NIH, the Health Human Services overall at every level, we've presented the information that we have about our schedules and how they've been working for us, as well as the international literature showing the efficacy of and safety of these schedules, particularly, for example, the AstraZeneca vaccine followed by a mRNA vaccine actually gives you a better vaccine effectiveness than maybe even the homologous 2-dose AstraZeneca vaccine, and particularly with our stretch interval. So we are hard at it. The United States, as you know, is going to begin to put down some vaccine requirements at the beginning of November. They are still working everything through at their end. So we are waiting anxiously to see what they will be doing at their end. But let's just say we have left no stones unturned to advocate for the vaccine schedules here.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
La prochaine question est de Olivier Ferrand-Boissé de TVA Nouvelles.
Question from Olivier Ferrand-Boissé from TVA.
La question est pour le
Good day to both of you. My question is for Dr. New. Dr. Scott Dudley from the United States has said that, in his opinion, the pandemic could end once vaccines are available for children. We also mentioned the Merck pill earlier. What is your take on this? Do you hold on hope for that post-pandemic phase? Thank you for the question. I can't comment on what others may have said, but in my opinion, and in Dr. Tam's opinion as well, I believe, and as many experts believe around the world, we have a pandemic. A pandemic is really something major. worldwide. In Canada, we have done well to date with our vaccine coverage. Our rates of severe illness compared to that of other countries is good. But as we say, no one is protected as long as everyone is not protected. Travel between countries is an important issue. Even if here in Canada we have done well with an 84% vaccination rate or higher, in other countries, vaccine coverage is not nearly so high. So much work is left to do. That goes for every country, but it also goes for cooperation between countries. I believe that Canada contributes to the international effort by sharing vaccines with other countries, for example. But we can't rest on our laurels. We need to keep striving to strike a balance. And there will always be options to use other tools like emerging medicines to fight COVID symptoms. But we know that prevention is always preferable to dealing with the illness once it exists. We may use the Merck pill in the future, but as of yet, that has not been approved for use in Canada. I think we are far from declaring the pandemic over. How will it happen? Well, perhaps in Canada, we will have different levels of manageability. That may be the same case in other countries of the world. Experts may call it an endemic situation, but we are not there yet, and we need to continue increasing our vaccine coverage. Thank you. Follow-up question? Yes. I would like to come back to the forecasts compared to the last update. We're looking at 3,700 cases now. That is, there is a discrepancy with the previous forecasts. Could you explain that? Yes. When it comes to forecasting and modeling, trends are based on the behavior of Canadians.
Les bonnes mesures de santé publique, je pense que dans plusieurs régions du pays, mais aussi, comme on dit, les Canadiens et Canadiennes continuent de pratiquer des
preventive measures in many regions of Canada, and also to Canadians who have used good personal protection practice. We are optimistic. The summer was relatively good, but now we need to be cautious because autumn is setting in. And the Delta variant of concern is highly contagious. Therefore, I feel everyone must still continue to follow public health measures, and we must strive to increase vaccination coverage. That is very important. We have seen unfortunate examples in some provinces where their intensive care units and other parts of their healthcare systems are under significant strain. That is a hard-learned lesson. We should remember that to try and prevent it in other regions. Thank you.
Next question. Prochaine question.
The next question is from Stephanie Taylor from the Canadian Press. Please go ahead.
Hi, doctors. Thanks for making the time to talk to us this morning. I wanted to ask about some reports from other countries about what to do when it comes to the Moderna vaccine for those under 30. Other countries have reported pausing this because of health concerns or potential outcomes. can you detail what Canada is doing on this front? Are you considering recommending that, those 30 and under maybe don't get inoculated with Moderna?
So the safety of the vaccines are really very important, and any signal is worth the investigation. So in Canada, as we follow the number of reported events after vaccination, we have detected an increased rate of myocarditis, that is the heart inflammation, after the Moderna vaccine, especially after the second dose, in younger individuals and especially in males. And so that's a sort of observation, which is, I think, in line with what's been observed in a number of countries. Right now, in balancing the risk and benefits, the National Advisory Committee on Immunization indicated that we should explain to individuals the risk of adverse effects such as myocarditis, but that the Moderna vaccine can still be offered to individuals age 12 and older. But we will be, of course, watching the situation quite carefully. I would say that between the age of 12 to 17, the majority of Canadians have received the Pfizer vaccine simply because of the way that the vaccine programs rolled out. Having started with the Pfizer vaccine, many of the youth have been vaccinated with that particular vaccine. So we haven't really been observing a lot of adverse events following Moderna necessarily in that age group, but more in the younger adults. But in any case, I think informed consent is very important and should be provided to the individual that you are providing the vaccine to. But that's where we're at the moment. And just to emphasize that we have some really effective vaccines. Moderna is a very effective vaccine, and in certain age groups seems to have a higher vaccine effectiveness, perhaps given the higher mRNA content in that vaccine. And so you have to actually balance the risk and benefits depending on the situation and the patient that you have.
It's Dr. New. Maybe I would just add to what Dr. Tam said, and I think we can certainly look at the sort of the relative risk, and it's for a very rare event overall, in terms of between the two mRNA vaccines, Pfizer and Moderna. But if you look at overall for all of the vaccines approved in Canada, they're very safe and effective. And although you could look at maybe relative differences between one vaccine versus another, at the end of the day, they're all safe and effective. They've obviously had a great effect in terms of protecting the Canadian population. If you look at the data we presented again, the most important, I think, lesson is to get vaccinated. Informed consent with whatever vaccine is offered. You can ask the questions, but at the end of the day, please get vaccinated. You can see with a relative comparison of rates for those vaccinated compared to non-vaccinated, especially hospitalization, 36 times. I can't think of a sort of a figure more compelling than that. Look at some of the videos you've seen now on TV with individuals in the ICUs who weren't vaccinated and now realizing how severe the illness can be. And hopefully they can also convince, maybe their friends and relatives, others who maybe might have been thinking like them before, that it is so important to get vaccinated. Thank you.
Thank you for that. Dr. Tam, you mentioned off the top that some hard lessons were learned in this fourth wave, specifically Saskatchewan, Alberta, are seeing cases surge after doing away with all public health restrictions. But even right now, Saskatchewan has chosen not to restrict gatherings for Thanksgiving. And I understand the advice you are providing, but that's still not a move the government has taken. So I'm wondering, do you think the Western provinces, Alberta and Saskatchewan, have truly learned the lesson from the fourth wave when it comes to removing health restrictions or keeping them in place?
Well, I think my general message is that you've got to be really careful right now. And the virus is still a very powerful virus, and you've got, quite a huge pockets of under-immunization in those areas. And I think, I would hope that if with this wave, that everyone has taken this to heart, and that things can be really serious. Look at the healthcare system and the fact that you have extremely exhausted healthcare workers. So one of the key indicators on top of the actual case rates and the escalation is the healthcare capacity to cope. And I think the difference moving on from the fourth wave and beyond is just how stretched the health system is, and that you've got to be really prudent, because there's no way of replicating and multiplying that health human resource in such a rapid space of time. So I would urge all provinces and every individual to do their part, because your healthcare workers are exhausted. Healthcare capacity can be different from different regions, but it's pretty clear that in some of these provinces, they are really, really stretched. So I guess time will tell as to whether individual provinces have learned from the fourth wave, while the vaccine, of course, the coverage is increasing. You can't just rely on the vaccinations alone. I would have to just say that it is great to see a jump in the Alberta and to slightly lesser extent the Saskatchewan uptake of the vaccine, given all the efforts that they're trying to put in place. But you still cannot rely on the vaccinations alone at this point.
Thank you, Dr. Operator. Next question.
The next question is from Annie Bergeron-Oliver from CTV National News. Please go ahead.
Hi there. Today's modeling looks fairly positive, which is a nice change. And I'm wondering if you can tell me a bit about what type of a game changer it will be once children, young kids, will be able to get vaccinated.
Yes, thank you for that question. So there are different types of modeling that you saw today. One is the projections or the forecasts for the next several weeks. And that is very much dependent on how we've managed, how we've behaved in terms of the population and the vaccine coverage. And so 2 weeks ago would affect what happens, 2 weeks later, that people have got that concept now. So whatever's been done in the last few weeks has worked, but we mustn't let go of these measures quickly while our vaccination rates are going up. So that's that piece of forecast. The next slide you will see is one that uses a much more complex dynamic modeling. And that at the moment doesn't have children vaccination, the vaccination of the younger kids injected into that model. I know that when our modelers are beginning to work at this, you will find that if you have kids age 5 to 11 vaccinated, it will make a difference over the longer term in terms of transmission. For this fourth wave, of course, it's a bit late for that, but for subsequent waves, you may see it reducing the peak of a wave, or perhaps reducing the duration of any subsequent bumps that you might have. But it is the modeling information is just being pulled together right now. So we might see some of that going into the future modeling sessions. But it will have some impact for sure. But primarily we want to vaccinate kids because the vaccine offers them good protection against being infected themselves. And even if serious outcomes are rare, some kids will get seriously sick. The other thing is that we don't understand enough at this point in time about prolonged symptoms or long COVID in the pediatric population, or indeed as populations as a whole. But because some of these long consequences and symptoms can occur even after a mild illness, that will have to be monitored very carefully. But I think the pediatric vaccines offer the next bright light or hope on our horizons, and it will add another layer of protection.
Okay, great. And as I follow up, I'm hoping that you can provide a little bit more context about slide number 9. Specifically, if I'm reading this correctly, it appears as though without public health measures, we see an uptick, and then it looks like cases go flat. Whereas with public health measures in the fall, it looks like we seem to have these small little waves, but it doesn't appear to go as flat as it does in the first scenario. I'm just hoping you can explain the differences there and why that's the case.
Yeah, so you're seeing hundreds and hundreds of simulations go through these scenarios, and I'm hoping I'm seeing what you're seeing, because some of the blurry sort of scenarios can be difficult to ascertain. But obviously with the scenario on the right-hand side, the bumps are generally lower going forward. So you have to read to the right of the vertical lines. And so if you compared the right-hand side to the left, you'll get a smaller sort of fall and winter wave. And then you may get another bump later on. But what you're trying to do also is that if infections were going through the unvaccinated population, you don't want it to go through all at once. So some of these measures will reduce rapid transmission amongst the unvaccinated and really just stretch out those cases over a longer period of time, so that your hospital systems are less overwhelmed.
Thank you, Dr. Tam. Operator, is there any other questions?
There are no further questions at this time. Nous n'avons plus de questions pour le moment.
Merci beaucoup. C'est ce qui met fin à la conférence de presse pour aujourd'hui. That will be all for today's press conference. Thank you very much.